My name is Michelle Day. I'm going to be doing our central line dressing change skills video. Before I begin, I'm in my Nightingale uniform. I have my badge on, my hair is tied up, I don't have any watches or rings on, and my nails are clean, no nail polish or gels or anything on my nails. I'm also going to do a quick room scan before I begin. Okay. All right. So before I enter my patient's room, I'm going to check on the computer, make sure I have orders for this patient to change his dressing line. So I do. So I'm good to go there. So I'm going to knock on my patient's door. Knock, knock. Hi, Mr. Smith. It's Nurse Michelle. I'm here to change the dressing on your central line. I'm going to come in. I'm going to provide privacy. I'm going to perform hand hygiene. I'm going to ask my patient, can you tell me your name and your date of birth? He does, and I check that against two patient identifiers. So we're all good there. So I'm going to ask Mr. Smith, while we do this, do you mind either turning your head to the side or I can provide you with a mask? So he would like a mask. So I'm going to go ahead and put on my mask first. And then I'm going to put on Mr. Smith's mask here. Okay, then I'm going to perform hand hygiene. I'm going to put on clean gloves. With my non-dominant hand, I'm just going to anchor the line so it doesn't dislodge or move while I'm taking the old dressing out. So I'm going to first peel up the corners, just parallel to the skin. And then once I do that, I'm going to pull my dressing away from the incision site so that we don't pull the line out or dislodge it or cause any damage to it. So we're going to remove the old dressing. We're going to throw that in the trash. And now I'm going to look at the site for any signs of infections, any drainage, any redness, any swelling, anything that looks abnormal, any rashes from the dressing that we just took off. I'm going to ask Mr. Smith, do you have any pain or discomfort or issues? He's all good. So now I can go ahead and change his dressing. So I'm going to take off my clean gloves and throw those away. I'm going to perform hand hygiene. I'm going to grab my new kit here. I'm going to open it from the sides and then folding it away from me so that it doesn't fall back on me. I'm going to pinch and grab my sterile gloves. I'm going to open these just with the edges. And then I'm going to take my non-dominant hand. I'm going to pinch this, put on this one. Then I'm going to cuff the other one. Put that on. Okay, so now my hands are sterile. So I'm going to grab my ChloraPrep and my gauze. I'm going to snap my ChloraPrep. I'm going to make sure it's completely saturated before I start cleaning. So I'm going to wait a few seconds for it to completely saturate, which it does. And so with my gauze, I'm just going to use this to hold my line up. And then we're going to clean for 30 seconds back and forth all around and make sure it's the area of the whole dressing that we're going to be putting on. So 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, and 5. So we got the whole parameter, and then we're going to clean underneath the line here and above. And then we can go ahead and drop that. We're going to throw this in our trash, and we're going to wait for that to completely dry. So we're going to give that a few seconds, make sure that everything is completely dry before we put on our new dressing. It is all dry now, so I'm going to grab my new dressing here. So I'm going to peel this off and then peel the new dressing off here. I'm going to make sure that we put it over. All the edges are down. And then we'll peel this outer part. And then once that all looks good, I'm going to grab my pen. I'm going to write my initials, the time, and the date. I'm going to go ahead and peel that off. I'm going to put it on the side of the dressing so it's not covering the actual incision site so that we can still see that. So all of that looks good. So now I can clean up. So we're going to throw everything away in the trash. We're going to throw this away. I'm going to take off my gloves. I'm going to perform hand hygiene. I'm going to remove my mask. I'm going to remove Mr. Smith's mask. I'm going to ask Mr. Smith, is there anything you need before I step away? So he's good. I'm going to make sure his call light's within reach. His bed is at the lowest level. He's safe. And then I'm going to go and step out and document the dressing change. And that's it. Thank you.